Hello and welcome back. So, continuing our discussion about the respiratory pharmacology, in this video we will talk about the mucoactive medications, and we will cover topics including the mucoactive medications definition, classification, therapeutic uses, and then we will talk about some examples like the N-Acetylcysteine, the Bromhexine, the Guaifenesin, and the Carbocysteine. So the mucoactive medications are medications that aid in the clearance of mucus from the airways. And the mucoactive medications are classified into mucolytics, expectorants, mucokinetics, and mucoregulators. So mucolytics are medications that reduce the viscosity of the mucus by breaking down the chemical bonds between the molecules of the mucus. Examples for the mucolytics include the N-Acetylcysteine and the Bromhexine. Now regarding the expectorants, so they are also called the secretolytics, and they increase the volume of the airway secretions, making them easier to expel through coughing. And examples for the expectorants is the Guaifenesin. Now regarding the mucokinetics, so those increase the ciliary transport of mucus, and examples for them is the bronchodilators like the beta agonist medications and the surfactant. And we also have the mucoregulators, which suppress the underlying mechanisms of mucus hypersecretion. And examples for the mucoregulators is the carbocysteine. Now, it is important to know that some of these medications work by multiple mechanisms to achieve their mucoactive functions. Now let's talk about the therapeutic uses of the mucoactive medications. So these medications are used in treatment of productive cough, in respiratory diseases that are complicated by oversecretion or higher viscosity of mucus, such as in chronic obstructive pulmonary disease and in asthma and cystic fibrosis. Now again, the mucoactive agents are used in treatment of productive cough, while the antitussives that we explained in the previous video, they are used in treatment of dry cough. So mucoactive medications for productive cough and antitussives for dry cough. Now it is important to confirm the diagnosis before giving these medications, because most common cause for productive cough is infections, and these medications may aggravate infections. Now, they may aggravate infections because they destroy the mucus, and the mucus layer entraps and clear bacteria and inhibit bacterial growth and biofilm formation, and it also protects the airway from inhaled irritants and fluid loss. So this would aggravate infections because the mucus layer is gone and the bacteria have direct access to the respiratory system. Now let's talk about some examples for the mucoactive medications. Let's start with the N-Acetylcysteine. So the acetylcysteine is classified as a mucolytic. It has a free sulfhydryl group that break the disulfide bonds that connect the mucin oligomers in the mucus, leading to a reduction in mucus viscosity. So the acetylcysteine breaks down the bonds between the mucus molecules, leading to a reduction in mucus viscosity, and the acetylcysteine also has an anti-inflammatory and an antioxidant properties which are helpful in treatment of some respiratory diseases such as chronic obstructive pulmonary disease. Now, the acetylcysteine is FDA approved for treatment of abnormal, viscid, or inspissated mucus secretions in pneumonia, bronchitis, cystic fibrosis, post-operative pulmonary complications, tracheostomy patients, and so on. And it is also FDA approved for treatment of paracetamol toxicity. Now, the N-acetylcysteine is available as oral, intravenous, and inhalational formulations, and according to the American College of Chest Physicians, the oral N-acetylcysteine is recommended for patients with moderate to severe chronic obstructive pulmonary disease to prevent exacerbations, and the N-acetylcysteine adverse effects include the gastrointestinal symptoms such as vomiting, diarrhea, and discomfort with the oral N-acetylcysteine, and the N-acetylcysteine side effects also include anaphylactic reactions, for example, bronchospasm, and those occur with the intravenous N-acetylcysteine because it triggers the histamine release. And whenever there is anaphylactic reactions with the N-acetylcysteine, they are treated with antihistamine medications such as the diphenhydramine. The other example for the mucoactive medications is the Bromhexine, and the Bromhexine acts on the mucus at the formative stages within the mucus secreting cells. The Bromhexine disrupts the structure of the acid mucopolysaccharide fibers in the mucoid sputum and produces a less viscous mucus, which is easy to expel. Now, because the Bromhexine can disrupt the gastric mucosal barrier, it should be avoided in patients with peptic ulcer, and the Bromhexine, in addition to it affecting the gastric mucosal barrier, it may also lead to headache, vertigo, sweating, and allergic reactions as adverse effects. The other example for the mucoactive medications is the Guaifenesin, and the Guaifenesin acts as an expectorant by relaxing the bronchial smooth muscle tone and by irritating the respiratory tract, leading to increasing the volume of fluid secreted in the respiratory tract. And this would lead to more fluid inside the mucus, and since there is more fluid inside the mucus is now easier to expel. And the Guaifenesin is available as capsules and syrup that is used in treatment of productive cough, and the Guaifenesin may lead to headache, drowsiness, diarrhea, and insomnia. The final example we have is the Carbocysteine. So the Carbocysteine suppresses the underlying mechanism of mucus hypersecretion and increases the fluid volume inside the mucus. The Carbocysteine is very effective and safe. It's used especially in asthma and chronic obstructive pulmonary disease, and the Carbocysteine may lead to allergic side effects. And with that, we reach the end of this video. Thank you guys for watching. Please give us a like, comment your ideas and questions, and subscribe.